Hello future OTs, it's Thalia, another awkward let's vlog in public day. It's Sunday and I'm about to meet up with Cassie and Rosie. So as far as I'm aware, my wisdom teeth surgery went well. I've just got some like cracking on the sides of my mouth and it hurts to smile and talk, but it's okay. Ow. I still end up laughing and smiling a lot, even though it kind of hurts. But we'll be a trooper and we'll get through it. So we have all finished our final 10-week placements, so I'm hoping I can ask them a few questions about that. And we have this last week before we start our final semester. So I'll try and get some feelings, reactions of how the girls are feeling about starting our final semester. I think I saw Cassie, but I think she's looking for a park. It's pretty busy.
You know how to be a heartbreaker, but you don't know how love goes. Baby, I know.
Remember here, right? I bet you're gonna put this on the video, aren't you?
What's your name?
Hi, I'm Rosie.
Hi, I'm Cassie.
And we remember our names.
Alright, so I'm finally here with these girls. It's good to see them. How long has it been since we've seen each other?
Like a good 12 weeks, maybe more.
Oh, it's so bright. So, Rosie, what was your placement setting? What can you tell us about your placement?
Well, my placement setting was a rehab unit, so I worked with both inpatients and outpatients, mainly the outpatients. So that was so I had a part-time clinical placement and a part-time project where I helped set up a new group at the hospital to increase the frequency of stroke patients' exercises. So that was good.
Yeah. So what was your placement, Cassie?
I was working in a stroke rehab unit.
So what sorts of things were you doing on your placement?
So we did quite a bit of remedial therapy, so cognitive retraining, upper limb retraining, ADL retraining, so making a client as independent as they can be before discharging them home from hospital. We also did some home visits and made suggestions to make their home environment more safe and better suited to their level of function post-hospital admission.
So I didn't really work on the wards. I worked mainly with outpatients, so that's patients who've already been discharged and they're going to come into me. And I worked a lot with helping them go back to paid work and advising whether or not they are eligible to continue driving. And some upper limb retraining as well. But with the inpatients, I worked with helping run an upper limb group. So that was looking at their exercises, and they might have been picking up a knife 50 times, but are they using their index and second fingers properly? Are they bringing in the fourth and the fifth to actually stabilize the knife? So that's kind of what I did mainly. So
what was your kind of favorite part about this placement?
I got along really well with the patients because last time was a pediatrics, but this time I was working with more older adults, and I found that I was more comfortable with them and I could joke around more, and I was forming better relationships, I guess. So I think that's what I enjoyed the most, was that I had a lot of time to talk and have those relationships with patients, which was really special.
What about you, Cassie? What was your favorite part?
Can we move?
Yeah, can we move? Because I can't, my arm is only a certain length.
Yeah, similar to Rosie, forming relationships with patients and their families, and especially being able to support the patients' families during such a traumatic and life-changing process was really special to me, and being able to help them recover and then seeing them achieve their goals. And I suppose patients who we thought had a poor prognosis making sudden amazing gains, that was very rewarding to me and my favorite part of placement.
So this lovely lady here has forgotten her questions. So in future interviews, tips for students, come prepared.
Those are my friends. I'm allowed to be sloppy.
Woo! There we go.
And guys, she only has 5 questions that she forgot. Can you believe it?
Alright, well something... So we did our last placement together in a pediatric clinic. So I'm interested to kind of hear, what do you think was a big difference, or was there something in the first few weeks of your last placement where you were just like, oh, this is completely different from my last placement?
Something which really struck me was in a pediatric clinic, how you talk with clients and their families is very strengths-based. So don't say, oh, your child at the moment can't do this, this is what's wrong with them, blah 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 blah, this is what we can do to make it better. We say, oh, your child, you know, although they're having difficulties with regulating their emotions, they are great at listening to instructions, so that's what we're going to do. So in my setting, it was very deficits based. So I had my CE basically listing down to a patient, this is everything which is wrong, this is how it's impacting. Like, it was quite almost confronting for me to hear that as well.
The other thing as well, because they're adults, you don't need to make your therapy engaging. You can just sit down with them and say, this is the problem, this is what we're going to work on, and they'll be like, cool. Whereas if it's a child, you have to implement games and fun things and sort of hide your therapy in that, and there's even then no guarantee that they're going to still comply with what you want to do. So for me, like, I didn't have to have a solid plan, I didn't have to have backups, I could just go in, talk to the client and work from there. Whereas working with children, you really have to think through how the session's going to run and what you're going to do if it doesn't run the way you want it to.
So it sounds like we all worked with adults then.
Yeah, Cassie and I worked in different organisations, but it was basically would have been the same setting.
Except you were outpatient and I was inpatient.
Yeah, which are just different spectrums along the stroke recovery stage.
I was working in mental health where consumers' insight levels would then affect their understanding of what we're doing and the groups we're running, or why we're doing a specific assessment and how that relates to their discharge as well. So not that it's similar to working in pediatrics, but then it's just kind of a different situation again from working in a more physical rehab ward when brain injury would have different levels.
Parkinson's, actually, that he could do a job where he was climbing ladders and managing heaps of people and time management, and he couldn't see past himself, and he was at about half the day wheelchair bound.
Yeah, but insight, even for stroke patients, depending on whether they have any cognitive deficits, is a big thing. I had one patient tell me there's no cognitive concerns and then score extremely low on all cognitive assessments that I did with him. And only then, once he'd done the assessments and I'd shown him what he was having errors with, like he could not even count money, like he wouldn't be able to pay for something in change. He couldn't read the time on an analog clock, things like that. Only once I'd shown him that he was having problems with that did he start to get like an inkling into how extreme some of his problems were. You have to make them aware.
Yeah, and it impacts on their safety once they get back into the community.
So we were also talking at our lunch just before about kind of some reflections on getting through placement and using SPEFA and things like that. So that's how we're assessed, using SPEFA. Cassie, you kind of brought up something that worked well for you. It was kind of like making sure you're documenting what you're doing.
So something I wish someone had told me when I started my placement, and this was especially useful for me because my supervisor or my CE clinical educator wasn't always around. She was really busy, and so I was often left to see patients and do things with patients by myself. So what I wish that I had done, or what I started to do halfway through placement, was to keep a list of the patients you had, interventions, assessments, and other things that you've done with them, and place that into the different aspects of the SPEF-R. So when it came to your halfway or your final, you had these clear examples, and you didn't have to be thinking back. Like, you see so many different patients and you don't have to think back across all of them while you're in your SPEF. You have a nice list and you can say, actually, I've done that and I've done that, and that's demonstrated my competency in time management and in documentation and in service evaluation because of what I've done with this patient. And your supervisor might not have seen any of that, and then you can still argue your point and argue why you should be marked up, or what your mark should be if your supervisor hasn't been there to see it. I would recommend doing that. And even just when you're applying for future jobs, having a clear record of
what assessments you've done, what interventions you've done, what sort of client populations you've worked with and are comfortable working with, that you can demonstrate to your future employer, is really helpful, rather than trying to remember back to when you were at uni and when you were on placement. And it's a stressful time, so keeping a clear record, I recommend as a top tip.
I think that's something that kind of worked for you too, Rosie. You had like a template that you used.
Yeah, so the organisation that I worked with, they were very organised in how all this went, and so they gave me a sheet which I used weekly, and it outlined, and I wrote down what I'd observed, what I'd assisted with, what I had done with my supervisor, and then what I'd done independently. And so that was recording all the types of different interventions, if I'd been in like a conflict and how I managed that sort of a thing, and different assessments, different intervention, and then I could see during the weeks as well, from week 1 to week 10, well, I had all this information up here now, but now I'm doing a lot of this kind of with my C and independently as well, so it kind of also tracks your progress as well.
That would have been nice to see, yeah.
It was really good, and it was nice document because I could record it down quickly, because you find a lot of the time that it's really hard to have the time to do reflections or to write down what you've done. But this was just a very quick, I've done the Rivermead ×2 independently. And that was all you really needed to say.
And then when you said you need something that you can jot points down quickly, on my placement it was so time precious that I wouldn't have any time to just sit and write a reflection and think through that. But to have a piece of paper where you can jot down like a single sentence of done that, and that's all you need, and then you later on can look at it and see all the things that you've done, and moving from doing mostly observational, doing things with your CE, to doing mostly independently, interventions independently. I think having a really quick thing is important.
No, that was an excellent document.
Sounds like across everyone's placement it's different how much they're seeing their supervisor, like how much contact they have with them, whether they're full-time, part-time. They might have lots of different roles they're doing as well. They might be having to be in 5 places at once all the time. So,
and you might even have more than one supervisor.
You might have multiple.
To communicate between your supervisors what you've done with the other.
And I think especially what you guys are saying, keeping that record of what you've done can just help you so much in the long run, but also help you with your self-reflection. I know something I said in my last video was it took for us in my last placement for the new students to come in and for us to teach them and hand over things, for us to realize, wow, I do know all this, I have done all this before, I can show you all this because I'm confident in it. But actually having that written down record where you can reflect back and look how it's moving from I was shadowing to I've done this all independently would be such a nice learning experience, a reflection opportunity.
Yeah, it was. Especially when you're in a setting and you might be by yourself and you're thinking, well, I can't see these gains at all. It's only when you write it down that you can actually see.
So we have this last week before we go back for our final semester, and we graduate early December.
Learn new things every day.
Don't worry, put that in. But so how are we feeling? 1 semester left. We've done our final placements. Do we feel like a little bit grown up? A little bit like almost OT-ish?
I mainly feel scared.
What about you, Rosie? Yeah, just a little bit.
Look, confidence is a big thing for me, so yeah, no, that's interesting.
Can you
you can do it, but it's a big step to take.
Yeah, I feel like I need to go back and revise everything from first year. I do know that I'm competent and I'm able to work in whatever setting I need to work in, but at the same, confidence. Being able to say like, yeah, I can do this, rather than, that's how I feel now.
Can you just reflect back if you can on some of your first fieldwork experiences, maybe when we did that Battelle assignment or that Knox preschool assignment?
I knew nothing.
You knew nothing?
I could do nothing.
If now you walking in and doing that and kind of having an idea of what an OT can do.
Even now, being able to say what assessment would be appropriate. Before we were told, okay, we're going to do this assessment. Now we can say, let's do this because this is what I'm seeing.
It's more meaningful for us as well while we're doing things. I've interrupted a really bad moment. I'm going, let's edit that out.
No, keep going.
No, I was actually finished.
Fine.
Okay, that's
Well, what do you mean by more like meaningful for us? Because we can see our contribution and we're part of that clinical reasoning?
Yeah,
or?
and it is. And before you're told, look, do this assessment for this kid so you can see development, and you're like, okay, I can see that now, but you know what? I've had to spend all this time just doing this one thing. It didn't make sense. I didn't like it. Whereas now you're going, well, this patient is presenting with this. I need to do this, and it's taking me 2 seconds, whereas previously it took me 3 hours. And I can actually see it benefiting people, I guess, was how it makes it more meaningful for me. And also, when you see a patient, it's a lot nicer than when you're just doing a case study.
Yeah, it can feel a bit of a disconnect when you're just doing case studies. Yeah.
And I think I've also noticed when we had that intensive week of study, just how there'd been such a shift in our whole cohort when we would discuss things, when people would put their hands up to answer questions, people were talking from experience and from a practical level of knowledge, and combining that with the theory that we were learning and thinking, how is this going to look in a clinical setting? How can I apply this? What have I done previously that I can reflect on in terms of what I'm learning now? And so for me, I felt really proud of how far we'd come as students, you know, especially thinking back to first year.
And you don't even really know what OT is.
Yeah, exactly. And we're having discussions about what OT is, and now we're talking about complex case scenarios and how we would manage that and what our experience is, and other people are joining in, and it's just been really nice to see our progress and development as OTs.
Yeah, I was like, is that your phone or an actual bug?
That's my mom.
Do you have any like last advice or things you want to kind of reflect on?
Form good relationships with people who are in your workplace. So don't kind of isolate yourself. I've found that a few people that I've talked to when they have difficulties is because they've kind of isolated themselves from other people. So even though you might be the only student in a setting, you're not the only worker in that setting. So even if you just like say hello to the receptionist and form like a friendly relationship with the receptionist, and that's what you look forward to when you walk through the door, it helps. If your CE is not in the building at the time, you knowing that you've got that relationship with another OT that can get help from them if you need to, really. Yeah, just remember that you're not by yourself. If you feel like yourself, branch out, say hello, be friendly, and you'll be amazed at what other people will do for you and how they will help you.
I definitely agree with that. Like on the wards, especially with nursing staff, they can change over. They might be casuals or permanent, but just kind of being a friendly face and introducing yourself, that can mean a lot for people as well. I mean, they might not always want to be your best friend each time, but just kind of practice making that connection with new staff and networking and
and also don't assume that although someone works in a hospital they know what an OT is or what an OT does, because always be ready to provide that definition and educate that person, you know, even if it's just like the janitor or a builder working in a hospital.
I've heard an OT have to explain it to a doctor.
Always be ready to explain and to say, like, to step in and say, actually that's an OT role and this is what I can do, you know, even though you're a student. I've had nurses discussing stuff that they're not sure about where I can, as an OT, step in and like it's something I can help with. And I guess one last tip is sorry.
No. It's just you sound like a little OT. So
don't be afraid to ask other staff, even if it's like the speech path or the physio or the OT assistant. Don't be afraid to ask questions, because remember, at the end of the day, like, they're all friendly, they're all there working in a professional environment, and they all want to see students succeed and they want to help. So if your CE is not around, don't stress out and think it's the end of the world. Just go find someone and say, hey, I need some help with this. Something has happened and I'm wondering if you can help, because they'll be able to help.
It's true, it's a profession where we are there to help people. So it's not as if they're going to be people who don't like helping.
Yeah.
Alright. Goodbye. They're just so, and
you forget human relationships in a way. and at the end of the day, find the opportunities to enjoy yourself. That's deep.
Put it on a t-shirt. I'll see you guys in the next one. Don't forget to like, subscribe, comment. Bye guys.
I'll